you hold on to your right knee, right, to pull up and just let yourself relax there. Right. A lot of people, when they do the test, they'll have a knee, just that's it, it'll be fine. If you just hold your leg, they hold a leg in that position there. And the normal way of looking at the test will be position of the hip, position of the knee, position of the knee, position of the ankle, okay? So you're looking at, if the knee is below the level of the hip, in theory, the psoas muscle is okay. And if the lower limb is relatively straight, then the rectus femoris is relatively normal. Happy with that initially? Mm-hmm. But then what you need to do when you do this test will be the leg that's bent, the pelvis needs to be fully posteriorly rotated, and you can do two choices. You can get your client to slowly pull the knee towards the chest, and the second thing I do is place your foot into your side. So rather than, I used to do it this way, because it doesn't matter with a man on a lady, whereas a lady doing it on a man, yeah, a bit awkward. So put their foot into your side, that's not me, and then from there, so you pull in.
Is that me?
I think it's probably mine, so.
Right, so from there you pull in, and suddenly it looks a little tighter now.
So by pushing against the foot, what's it doing?
Posteriorly rotating.
So the opposite side, you're fully posterior rotating, which is the starting point. So from here, alright, so you can lean in, then you'll notice that the rectus femoris is not bad. Psoas, there's a little bit of tightness in the psoas. But what you want to have read is that you can look at, Jan taught a friend of mine and my friend taught me, and what he says is have a look at some springing, like 10 to 15 degrees of spring. So if you just watch this now, okay, so I'm just passively just stretching there, and there's not much spring there, and it bounces back, see that? So psoas, there's a little tightness in the psoas, it's not drastic, it's a little bit tight there. Rectum is a little bit, but not much. Thing is, when you're looking at muscle length testing, you either say it's tight or it's not tight. Whereas muscle testing strength, you can say, well, is a grid 5 is normal, grid 4 is not so normal, yeah, 0 is nothing, yeah, and there's all to do with gravity and whether you can resist against gravity. Whereas in this one, that measurement goniometer, you'll say, well, it's a little bit tight. Yeah, so you either say it's tight or it's not tight. So if you want to use a grading system yourself, and that's fine. If you say, you know, on a psoas, the worst tightness I've seen in a psoas is on a hockey player, a female who's about 19, and she's like that, with a rectus femoris like that.
Oh my God.
So you could say that would be a grid 5, yeah, whereas Fiona will be a grid 1, if that. Alright, so you can grade it in between, but it's your interpretation of that test. If someone else looks at it, they go, I don't really understand what you mean, but it's your notes, and you decide. What you can also do from here is, if I palpate the IT band, what am I going to say? It feels what?
Probably quite tight.
I'm going to say it feels tight, in inverted commas, but if I was to bring that knee towards me, okay, we have lots of movement there. So there's no real tightness in that band, even though it feels tight.
Oh, that's an interesting idea.
See? And also from here, take my knee away. If I palpate that tendon there, which it feels a bit tight, and I take the leg into abduction, it's a bit tight that way, you see it? So we've got resistance. So IT band seems okay, psoas is a little bit of tightness, rectum is a little bit but not much, but the adductor is a bit tight on that left leg. From this test.
Which probably accounts for a couple of years worth of problems, which was identified as weak glute med.
Alright, which is maybe why it's weak, because your adductors are a bit tight. So when you test the other leg, never allow this leg to drop down, so you're hyperextended. So you bring this leg up, you pull in on that one, yeah, and then you just pull it tight, and we just do a test again. So I come into the side, yeah, pull, pull, pull. Rectum's tight on your right. No, it's not. This is where you hold it. The psoas a little bit, adductor a bit tight. IT band's okay. And there you have it. So that's a modified, and then from there you can do some stretching if you want. You know, if you want to do some stretch for your rectum, it's easy to do it from here. Like for instance, Fiona could stand and pull a heel to a bum very, very easily. But if you just watch me now, just tell me when you feel a bit of a pulling in the leg.
Yeah.
Yeah? Alright, look at the distance between heel and bum, miles away. So I can stretch rectum from here. Yeah? But also what I could also do, you know, even though it's more of a quad muscle, you know, you could sort of like fix any of the tissues here, soft tissue release, or slide in STR you want to call it, or a active release. So you can fix any of these. If I, you know, find say I start high, in just above the belly, so into the more muscle tendon, and then from here if you slowly pull in, I can just lock in there, and then ease off, and then lock in, yeah, and ease off, and I can just work down a level, and lock in and slide up, alright, and lock in.
Yeah.
So I don't really need any cream, I can just do that Try. Yeah, locking in.
You can, if you do this standing as well, you can assist it by pushing your
Yeah, I can do
leg,
it.
because
Yeah.
I'm feeling I can't really get it
Yeah,
far
yeah.
enough back.
So then I can sort of like
Yeah.
lock in, yeah,
Yeah.
and then I can just
And
sort of like,
get back on the side.
I can do all this as long as my glute meters are strong enough.
Because otherwise I can't feel it do it myself,
Yeah.
I can as soon as you put some pressure on it.
What you can do from the side. So little things like that. So by, you know, if you want to stretch your adductors, hold on to that knee again. So from there, if you pull the leg up, so the adductors are a hip flexor, you pull your leg up and in. Alright, so you're adducting, hand in flexing. You'll get psoas and adductor, sit down, relax, let the leg drop. And if I just push that leg away a little bit and down, I'll show a bit of stretcher. If you don't feel it, the patient can slowly pull the knee towards the chest and you can control how much stretch you have. Alright?
Yeah.
Okay. Let me do it.
I think I've asked for it now, haven't I?
So a little bit of psoas coming down. If they don't feel too much, they can pull in that way. Yeah, so I can just lengthen through there. You okay? Yeah. And then from there, I can then bring the leg down and across. You alright? Feel it? Not? Yeah. If you find you need more pressure, I can use my knee, my right leg. I can just lean over a bit. Alright? Yeah. She's done quite well. Suck it again. So that's a good way of sort of stretching those. So you can do psoas, adductors, and then from this position. What I suggest is, when you do it for real, the temptation is to do quite a lot of stretching on one leg before we do the other one. What I do these days is do one stretch on one leg, bring the leg up, so you give the groin a rest.
Yeah, it needs it, doesn't it?
Yeah. You do this leg once, give this groin a rest, do that leg, do that leg. So you alternate between the two, otherwise when you release the leg it's like, oh my god, it's so uncomfortable in the groin. Yeah. So maybe just do a little bit of stretch, ease off a little bit of stretch. But be careful with psoas. Psoas is a very, very sensitive structure. It doesn't like too much stretching. Yeah, it's very reactive. Okay, so back off a bit really, rather than forcibly lengthening it all the time. You might want to release it in a different way. Like maybe find it, go for the abdomen and just release it by doing your STR stuff on it. That's what I would do, rather than, because when you're stretching also, you're also stretching a joint capsule. Maybe the joint capsule, the ligaments don't really want to stretch too much.
I once worked, you know, the river dance
Oh yeah, okay.
dancers,
Yeah,
the troupe.
that's it. So, yeah.
Once worked on them, Bristol and Plymouth, and they'd have a list of all the people that you need to work, and
Yeah.
you'd have the main lady, the two key players, and then like the tapper and the Russian dancers and all that sort of stuff, and then eventually you'd get a couple of every now and then